Hello, I'm really honored and excited to participate in the second International Teaching and Research Week at the University of Lusófona School of Economic Sciences and Organizations in Lisbon, Portugal. I feel like I'm there with you, even though I can't physically be there with you. Many thanks to the Associate Professor Helena Martins for being my host professor, and I hope to collaborate with you in Greece. I'm also looking forward to a further active role in this collaboration. I'll share my screen. Okay, so it's Make Leadership Matter, a crisis framework overview. And who I am. I have an 18-year work experience throughout the military and public sector. Say a few words about me, so you know as how I'm involved in all this presentation. And my work experience is on migration policies, forest policies, human resources, military strategies in the Pentagon for a few years. My present management job role as a head of General Secretariat Division and Public Relations and Antiquette comprises of three main accountabilities, and that is strategy coordination, policy development, consultancy, and organizational development. I'm a liaison. I act as a liaison between the divisions of the hospital in order to assure the successful policy and development, multitasking and dealing with a large number of issues, tasks in relation with high-level political topics, and that involves horizontal, vertical working relationships through communication with diverse teams of professionals in order to succeed a broad range of operational tasks. And I'm referring to that because that is also the case during COVID-19 to get involved with different teams, divisions, organizations to cooperate in small or large scale health projects. For the past 2 years, I'm working on my PhD thesis titled Exploiting Relational Leadership Theories to Improve the Effectiveness of Management in Healthcare Organizations with my supervisor and friend, Associate Professor Aspasia Gula. And I believe that our core message until today is that we can make leadership matter. So the current crisis situation influences leadership more than ever. It influences us, and I may say that some of us are challenged to think differently and challenged to being pushed. This crisis context pushed us to think differently. Ways of working, new ways of cooperating with our work partners, new ways of showing our feelings to other people. We wear masks, new gestures. We have altered the hours we spend with our children, for those of us who have children. It is also obvious that the current situation is based on human relations in a crisis context. This lecture is going to dive into crisis situations leadership through the lens of operational response, human relationships, organizational structures, crisis protocols, and the descriptions of the agents that underpin the current necessity for health preservation, resilience, and adaptation. I'm going to dive into the meanings of leadership, readiness, health preservation, shared knowledge. All this can be achieved through strong human relationships. So be a leader, be the change. I use the word be. Why do I start with bees? Because bees seem to have some characteristics that are in the core of leadership theories, and those are that there's always a queen bee, but also many other leaders. The main leadership structure is based on decentralization, which actually means that data travel from main queen to bee groups, And in every group, there is a local B leader that spreads and divides the data even further. So it is a leaderful ecosystem, not a one leader matter. It is a leader-member exchange. It is never a one leader matter, okay? Leadership depends on those who follow and not only on those who lead. That is, big workers not only get the job done, but they also pay attention to the leader's performance, and they play a significant role on evaluating her ability to lead. There are always successors in a readiness state. That means that hives are communities that create future leaders, which is actually the core mission of any organization that seeks for sustainability. Each member counts. Every bee has a unique role, regardless of the age. Organizations should also focus on promoting diversity, age, sex, unity, and human relations anyway. Build a community that promotes accessibility, equity, and social justice. Bees work on adaptability. They balance the temperature of the hive. Few find new areas to work. That is, they do the day-to-day running of the business, collect flowers for the bees, but they also search for future productive locations so as to be ready to relocate when needed. Adaptability is sustainability for bees and for us as well, for organization. Adaptability, sustainability, and in sustainability, it's viability. And they also have constant awareness. Having a greater awareness of what is happening inside the system, the beekeeper, means that you prepare like a bee. Having a constant awareness of the system changes means that you have readiness, and readiness is another way of building on prolepsis. So, since each member counts, and since leader and member have very important roles, the roots of leadership and followership is the need to coordinate. We need to coordinate. Be a leader, be a change. We can be talking of how bees cooperate for the sake of their ecosystem. There is a research that analyzes a 14-year United States Geological Survey data set of wild bee occurrences from more than 1,000 locations in Maryland and Washington, D.C., examining how different bee species and communities respond to land use and climate factors. And they are analyzing that because we have climate change. And so climate change means it's a complex situation for bees and for us as well. So they see how they respond. So we can be talking about bees and how these are cooperating for the sake of the ecosystem, and then focusing primarily on how humans cooperate for their organizations. Organizations are trying to do two primary sets of activities, and that is to innovate, launch new products, launch new business models in order to follow up to the constant change of organizations and the ecosystem in which they are operating. So part of this change is innovating in nature. And the other set of activities is exploitation, the day-to-day management. Professor Mary Hill Bean has a great paper on that, focusing on how to achieve organizational adaptability. With increased complexity, globalization, and interconnectedness, companies are forced to adapt to constant change faster than ever. Because adaptability is sustainability, adaptability is viability, as I have aforementioned. The intense pressure of companies for short-term gains leads to focus on profits over people. That focus may lead to selecting people that will generate them. Managers squeeze people to generate profits in short term, so they are placed in leadership positions. These results-oriented policies eventually lead to dehumanization of organizations. So we were mainly focusing on maximizing shareholder profits, profits over people, and on exploitation by the classical entrepreneurial activities, systems, and procedures. The new normality, though, must be enhanced human interconnectivity. That has hopefully eventually changed to meaning of a firm's work beyond quantitative measures of financial performance and objectives to create businesses with a defined purpose beyond just making money. Soon enough, organizations have seen that while King, Johnson, and Van Gaal say in a paper, a simple two-player coordination game illustrates that in many situations, leadership is almost inevitable. Imagine a pair of individuals with two simple goals: one, to stick together for protection, and two, seek resources such as food patches and waterfalls. It is always a player's game and not a numbers game, not a shareholder's profit. Primarily, we need to focus on human relations. So leadership and followership, which are actually human relations, emerge everywhere in group activities like hunting, teaching, loving. Today, human society continue to rely heavily on political, economic, military, professional, religious leaders to function effectively. Yet the consistently high rate of leadership failure, managerial incompetence of business failures in corporations suggests that new approaches may be useful in understanding when and why human leadership succeeds or fails. So, disasters, bioevents, COVID-19. COVID-19 is a bioevent, and it is a disaster. Why? Disasters may be defined as a large-scale, stressful, environmental or technological event on land, at sea, in the air that adversely affect a significant number of people. So we may have technological or human-caused events, toxic spills, nuclear accidents, large scale of transportation accidents, plane crashes, and of course natural, if we can call that, disasters such as hurricanes, earthquakes, and bioevents, COVID-19. So disaster is a large scale and adversely affects a significant number of people. So let's go to the hazard definition. Hazards have potential to cause disasters. Hazards cause disasters only when they meet with vulnerable people when affecting. When affecting what? When affecting human life, property, human activities. Disasters and crises are not abnormal phenomena. They are mirroring the way societies structure themselves and distribute their resources. Although the vast majority of threats to international public health security are posed by well-known epidemic-prone infectious diseases, often result of the transmission from vertebrate animals to humans, countries must also be ready to respond to diseases that may arise from industrial pollution, unsafe food, or radiological events. These accidents that may put millions of people at risk in several countries. So hazards cause disasters when they affect human life, property, and human activities. And now we go to disaster's definition. A disaster is an occurrence disrupting the normal conditions, like we have today, disrupting the normal conditions of existence and causing a level of suffering that exceeds the capacity of adjustment of the affecting community. Preconditions to have a disaster: disrupting normal conditions, exceeding the local capacity, affecting people. It is the people who matter most, and without people, we have no disaster. The people matter most. It's just a physical phenomenon if we have no disaster. Without people, there would be no disaster. It's just a physical phenomenon. Imagine if we had COVID-19 without human losses. Or think of an earthquake in the middle of the desert where no people are involved. It is not a disaster, but a geological incident. Disasters and other emergencies often result in significant impacts on people's health, including the loss of many lives. Every new threat reveals the challenges for managing health risks and effects of emergencies and disasters. Deaths, injuries, diseases, disabilities, psychosocial problems, and other health impacts can be avoided or reduced by disaster risk management measures involving health and other sectors. So let me introduce you to the context of this study. COVID-19 crisis management. We have prolepsis. What is prolepsis? Reduces the possibility of the phenomena appearance, immediate avoidance of the negative effects of hazards, and means to minimize environmental, technological, or biological disaster. In organization, prolepsis is meant as enhancing human interconnectivity and creating adaptive spaces that will allow adaptability to occur anyway. That's the local crisis context. We have prolepsis management, and then we have response to a phenomenon, response to the disaster. Response reduces the impacts, a set of decisions during and after the disaster, including immediate relief, restoration, and reconstruction. And then, after that, we have rehabilitation, which is restoring the community's ability to recover from the crisis through sustainable development actions and humanitarian aid. It sets the basis for further development. Prolepsis is the most important because it reduces the possibility of the phenomena appearance. And we must focus and invest on prolepsis, on readiness. Who is affected by the crisis context? Everyone is affected by the crisis context. To begin with, leadership readiness is tested at the national, regional, and local level amongst governmental officials and agencies, healthcare providers, and health policy experts in protecting, responding, recovering with the crisis within the crisis context, as well as amongst citizens, businesses, business owners, and employees of organizations who were expected to use health and hygiene guidelines that were given to prevent dispersion of the virus, to support organization sustainability and adaptability by their work experience, knowledge and innovative skills, and finally, to withstand the crisis. A health crisis, unlike an economic crisis or a work crisis, universally affects in such a short period of time so many countries and in such a depth, entraining economy and society in a speedy downturn. For instance, a sharply and markedly increase in youth unemployment has made its appearance since February 2020. So an additional challenge is that societies have to beat the pandemic, and in the same time frame, policymakers have to protect the economy without mass job redundancies. Fast competitive market unpredictability. What do we mean by fast competitive market unpredictability? Soap dispensers thrive while restaurants will shut down. We also have the fear of contamination, abrupt change of work conditions, remote work. And of course, we have the exceeding of local capacity. And that is why a pandemic outbreak like COVID-19 is characterized as a disaster due to its immense impact on human lives. And it will still lay there, affecting communities, businesses, market, healthcare organizations, academics, scientists, for far too long. We have to see readiness, which is one of the steps to take in disaster protocols, from two sides. And those are readiness as a state of being able to respond effectively when needed, and readiness as another way of prolepsis. Because if we are ready, that means we have thought of the parameters that will allow the system to function under adverse situations. I like this phrase. It's not one size fits for all data exchange situation. The world crisis actually refers to a deep value, rational, sound judgments and decisions that a leader needs to immediately undertake using all the power and knowledge that he possesses. Crises are characterized by three factors. That is the depth of the crisis, the duration of the crisis, and the resilience that we exhibit. Therefore, leaders' decisions during the crisis are affected by the size, the time, and the reaction upon the crisis and in the specific social context. That is why we have witnessed differences in numbers of the deaths from COVID-19. So, time in crisis is not only meant as duration period, but also as how fast, speedy decisions we make. Here are the common denominators. The main common denominator is that we have health at risk across all the existing systems: health, commerce, education, construction, tourism, financial, shipping. Okay, decisions are made under tremendous time pressure. There is no capability to foresee the full consequences of those decisions. What is not a common denominator is the resilience schemes and the recovering and adaptation methods and skills each world partner embraces the day after of entering the new normality. The classic bureaucratic structure. Classic bureaucratic systems are functionally departmentalized and impersonal, and the latter are characteristics that do not enable fast knowledge sharing, strong relationships, and adaptation because they do not conflate non-linear dynamic networks into the organization chart. They are focused on imposing by order and control. The current healthcare systems and structures have not been designed to bring an adaptive response during the crisis, combine immediate action, and an operational response and cooperation in a governmental level and in a complex environment. Operational response is also meant as a prefixed dynamic knowledge sharing mechanism that would allow prolepsis practices to immediately scale up across the general population. Classical bureaucratic systems do not enable that fast knowledge sharing and that do not enable strong relationships and adaptation because they do not conflate non-linear dynamic networks. So they do not push towards an operational response. Yet, plenty prolepsis solutions emerged as semi-autonomous and in an unsystematic fashion in a speedy way through the internet. For instance, a massive knowledge sharing was that of the ways of chewing masks, washing hands, respiratory etiquette, paradigms of social and physical distancing, mental supporting, and a rich flow of news on health issues, making the party adaptation doable through the existing networks. Another paradigm is the Ministry of Health in Singapore that developed many smartphone apps that traces user contacts and sends them notification if their contacts are infected patients. So networks in that case preserved health through shared knowledge. Another paradigm of shared knowledge is the global partnership across the world, like common international travel restrictions, quarantine in specific geographic areas, partial closure or closure of schools and other public and social measures as united actions for global health. So if we want to lead the crisis, we have to implement disaster risk reduction. We can't prevent a hazard from occurring, but we can prepare for disasters, deal with the health consequences, mitigate their long-term effects, and we can lead the crisis and mitigate its impact by making people more resilient. Priority 1, understanding risk, disaster risk. Priority 2 is strengthening disaster risk governance to manage disaster risk. Priority 3 is investing in disaster reduction for resilience. And priority 4 is enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation, and reconstruction. Government officials and agencies and health and disaster policy experts ought to make their full contribution to the effort of reducing risk and prepare for disaster. It is a broad, people-centered approach to reduce disaster risks in the current or in the future bioevent caused by natural or man-made hazards. So it is urgent that leaders across the globe anticipate, plan for, and reduce disaster risk in order to efficiently and effectively protect persons, organizations, communities, and socioeconomic ecosystems. In the tactical level, we can use the phrases like defining, describing, and dealing. How to define, how to describe, how to deal. The protocols of leading this health crisis were structured based mainly by defining infection preservation and control and its role in the context of preparedness, readiness, and response, describing the current epidemiological COVID-19 situation, including case definitions and signs and symptoms, describing source control, administrative and environmental engineering controls, designing measures for health and care facilities, dealing with suspect and confirmed COVID-19 cases, of course, and taking additional infection prevention and control measures to assist in general preparedness within a healthcare facility. The coronavirus response, this is a holistic approach. It is a people-centered approach. The coronavirus response will only be effective if all targeted people can be screened, tested, and if found ill, treated. This is why you will need to identify people who may be hesitant to come forward for treatment. That's why we talk about people-centered approach. Some people may hesitate to come forward for treatment. Those who are living with conditions associated with stigma, or indeed those who fear they may be stigmatized for having coronavirus, can be driven to hide the illness and in order to avoid discrimination. This may prevent people from seeking healthcare immediately and discourage them from adopting healthy behaviors. It is important, therefore, to provide supporting messaging and care. In this regard, the rights, dignity, protection, and assistance, human dignity, community engagement, protection and will enhance people's safety, dignity, and rights to avoid exposing them to further harm, discusses protection risks, and including the importance of context analysis, the treatment of sensitive information, and supporting community protection mechanisms. Can also give access to impartial assistance according to need and without discrimination. This principle expresses the right to receive humanitarian assistance. Let's not forget that focusing on preventing the spread of coronavirus should not make us forget affected people's other needs, no long-term medical needs of the wider population. There are some papers that have already been published on people having the HIV virus, talking about not responding to their treatment due to fear to get out of their homes or to their health centers or to the doctor that treats them. Operational level now, coronavirus intersectional response plan. On the operational level, we need rapid action with quick effect. Defined monitoring and reporting procedures with outbreak indicators reports, specific and agreed roles and accountabilities between the involved teams, intersectional. Without agreed accountabilities, we cannot proceed. We need to know who does what. Safe control of key vectors, of course. Promote early warning system and health-seeking behavior at healthcare facilities. Risk-focused local community engagement and hygiene protocols promotion. System interoperability and constant access public health data to update and adapt action design. And the operational level proceeds with leading the vaccination. And I will explain to you what means leading the vaccination. Of course, we have a rich flow of numbers. More than 2 million people, 2 million vaccinations have been carried out since day one, says our Ministry in Greece of Health at April 26. And then we had news about when does the e-platform opens and for which age group and how to make an appointment. And then we realized that some of the age groups did not really make the appointment. And on May 6th, yesterday, on May 6th, we have that more than 100,000 vaccinations have been carried out. And that so far, we have vaccinated about 50.4% of the country's population. Still, a part of the population, and those are the elderly people, did not make the appointment to get vaccinated. So how do we lead the vaccination? How did the government officials lead this vaccination program? The government officials have set an example of Mr. Michalis Ioannidis, age 28, who was the first elderly man in Greece to be vaccinated in December, trying to lead older people to get vaccinated. That, in leadership, we call it that leader used role models. It has been acknowledged that role models may have a profound influence on career decisions and therefore may also enhance the desire to become an entrepreneur or enhance entrepreneurial self-efficacy of individuals, and thus positively influence entrepreneurial intentions and entrepreneurial activity. The phenomenon of role models can be explained by theories of role identification in social learning, where role identification can be seen as a cognitive response to an individual's belief that the characteristics of another model person are close to his or her own models and character, and that this model plays a desirable, often central social role. Then we have a rich flow of news about what the vaccination, what its vaccinations, if the vaccination is good or not, and if it protects health, if it brings with it some health issues. So the Ministry of Health on April 26 says that more than 90,000 pregnancies with mRNA vaccine provide evidence that mRNA vaccination in pregnancy is safe. Some pregnant women were afraid to go and get vaccinated. That is a rich flow of knowledge sharing. At the level of your organizations, any good source of information or a new way of safe working must be seen as knowledge sharing and should be institutionalized and get embedded into the systems. Knowledge and innovations are the engines of sustainable growth. Then we can further enhance knowledge sharing by lifelong learning programs. So here we have the leader use the rich flow of knowledge sharing. And raising awareness among young people in the 30-39 age group about getting vaccinated with AstraZeneca, government officials have been vaccinating, setting an example. What is this? What does it mean when a government official vaccinates himself and shows that on the TV? That is leading by example. He does what the followers must do, and he does it as a leader. So he's leading by example, and he leaves the rest, the followers. to follow. So a paradigmatic assumption of visionary leadership in crisis context is that amidst the period of 2011-2016, in the context of Greek fiscal consolidation, some companies avoided dismissals by reducing weekly working hours, reduction in salaries for 3 years, in parallel with a number of waves of voluntary exit schemes. In Greece, for that moment forth, the model of we can survive through a common compromise was considered as offering a socioeconomic stability. The aforementioned common compromise included a vision, and the vision was save the country, save Greece, or we will all suffer by the austerity measures, but we will make our way out of the crisis. So the trust to the why we do it, the purpose, resulted in a nation that followed. People did not operate through decision making because the answer to what do we gain had been the austerity measures. Same thing now. The current tremendous health crisis threatened the existence of humanity, and the full participation of the society member was needed in order to overcome. Members of society reacted the exact same way. They positively responded to the call of the leaders that said, follow the hygiene orders. Wear your mask, put on your masks to save the world. Don't touch, keep in touch, just don't touch each other. Very few of the participants during the pandemic actually visited or utilized health services, so they did not have a tangible gain. That is, they responded positively to the purpose of the vision, which is the key element to start a healthy organization in the business world anyway. So people in both cases did not follow the what, meaning what do I gain? What do I gain? Because the what had been the austerity measures on the one side or the restrictions to non-essential movement on the other side. No leader says we have a crisis and you will do that. They always say we have to withstand and overcome the crisis. And there are some steps we need to follow if we want to succeed. So it's always about a quality leader-member exchange. And in these relationships, member, whether it's employees or citizens, vision is the reason to follow. The reason to follow is it. As I have mentioned at the beginning of my presentation, the roots of leadership and followership is the need to coordinate. And in COVID-19 crisis context, we definitely need to coordinate. So crises need leadership and they need vision. But is the vision itself enough? Of course not. The aforementioned operational response combined with entrepreneurial response will bring us in front of a sustainable and adaptive response to the current crisis context. So that needs deep human cooperation. And of course, as you have seen here, it's not only the lead dog that has a good view, it's a leader-member exchange, as I have aforementioned. So leaders should use the entire team's skills and use all the participative leadership tools that they have in hand. Well, as in every project, we always have common emergency leadership files. That can be poor fast decision making, poor task allocation, communication failures. So in these tremendously fast change work conditions, practitioners, CEOs, managers, employees have obtained new task relevant skills and impelled human relations amidst trying to operate and produce effectively and maintain situational awareness during the disaster. Thereby, human capital is the stepping stone of performance and competitive advantage for the organization. We see here the mistakes. Poor fast decision making. Occasionally, we will have to deal with an underperforming employee, let's say. While we are in a fast-paced changing environment during COVID-19. And in such instances, it's tempting to look for a quick fix after all. Poor performance. But poor performance will have a detrimental effect on the teams, on the team as a whole, which will in turn affect upon us as managers. Before we can address poor performance, we will need to understand the underlying reasons. They may be caused by, may be associated by to low ability, like overlay difficult tasks, or low individual natural ability or knowledge, or lack of participation in lifelong learning circles. We can address low ability by offering extra training, reassigning the employee, providing them with additional resources. Sometimes poor performance has its roots in low motivation. When this is the case, you need to work closely with the employee to create a motivating environment in which to work. There are 3 key interventions that may improve people's motivation. And that is setting of performance goal, provision of performance assistance, or provisions of performance feedback. The lack of situational awareness, Stanton, Chambers, and Piggott in a paper in 2001 refer on the concept of situational awareness was identified during World War I by Oswald Volk, who realized the importance of gaining an awareness of the enemy before the enemy gained a similar awareness, and devised methods for accomplishing this. So this idea of separation between human operators' understanding of the system status and actual system status is the crux of the definition of situational awareness. Human operators' understanding of system status and actual system status. And poor task allocation. How should individual units choose what functions to perform? What are the demands for different functions or tasks? What are the pieces of our puzzle? Is our specialization based on individuals' unique benefits? Age, education, reconciling work and family life in times of crisis. And last, the communication failures. As Lohmann says in his communication theory, it arises through a synthesis of 3 different selections, namely selection of information, selection of the utterance of this information, and a selective understanding or misunderstanding of this utterance and its information. And these are the bridges of communication. As you see, the bridge of non-qualitative oral and literal communication is very different from the bridge of qualitative oral and written communication. Communication is a key thing, specifically in the crisis context, where we need fast decision making and fast changes. So we have to have a rich and good qualitative flow of information from the leader and the member and the feedback. So crisis calls for leadership. Problems that arise during the pandemic in the workplace, we have seen those. We have seen those in our organization. We have role conflict, ambiguity, quick not fixed actions, fear, anxiety, grief, occupational stress, increased competitiveness, high demands for work efficiency. We should fast adapt to an e-class and to a distance teaching or remote working or telehealth, and also high demands in customer service from a distance, delivering the products to the client, to the customer. Steps to take during the pandemic. obtain new task relevant skills, simple human relations, quick fix actions. Leadership by definition is the process, let's say that leadership by definition is the process through which organizations direct human behaviors to achieve common roles. So it is the process through which organizations direct human behaviors to achieve common goals. For instance, long unpaid hours do not prepare human capital to stay resilient during a crisis. Impel human relations. An organization is not just the aggregation of individuals. Of course, it's not the great aggregation of individuals. It's the relationships between them that takes the organization one step further. Also, we have to use calm leadership methods. Emergency situations present an imbalance of resources demands and resources supplies. Resources demands and resources supplies. We have an imbalance during crisis context. So a mature dialogue between the leaders and the members is important in order to map the current needs, hygiene supplies, equipment, flexible work schedules, balance of work and family life, and figure out a witty way to create safe work practices. Needless to say that preservation of health does not refer only to avoiding contamination on spreading of COVID-19, but also it refers to sustain the mental health of the members of the organization, and specifically for those involved in the provision of healthcare services. Using mechanisms for mapping needs and a mature dialogue between leaders and members, and especially the mature dialogue between leaders and members, is a way to create safe work practices. We can find common solutions and common pathways to get through and proceed in our organizations and implement the COVID-19 protocols and in a safe way and with the feeling that everything is going okay. So using coping methods is important. What do we mean? It's important that leaders act in a framework that promotes adaptive defense mechanisms and coping mechanisms. This is the unlock system, and we have all these role conflicts and ambiguity. And now we must transform to and relock the system. What do we mean relock the system? Relock the system means that we have to institutionalize and get all those changes embedded into our system. Okay? Institutionalize those changes, embed them. Crisis calls for leadership, managers and leaders. Managers for frontline workers are supposed to provide accessible information, help them shift from treatment to prevention across all sides of organizations, promote well-being as a joint responsibility of both individual and the organization, and help them manage with stress, and of course, increase resilience. What do we mean by promoting well-being? Workplace well-being relates to all aspects of working life, from the quality and the safety of the physical environment, to how workers feel about their work, their working environment, the climate at work, and the work organization. The aim of measures for workplace well-being, we measure, we make sure workers are safe. Why do we measure that? We want to measure that workers are safe, healthy, satisfied, and engaged at work. Workers' well-being is a key factor in determining an organization's long-term effectiveness. Many studies show a direct link between productivity and the general health and well-being of the workforce. So enterprise and organizations are increasingly recognizing the need to take the well-being of their workers seriously. The more progressive organizations are doing so because they appreciate that their most important resources are the human resources, their people. Some others are beginning to address well-being issues because it is becoming increasingly clear that many workplace problems draw from the lack of commitment to the needs of their employees, especially now during the COVID-19 crisis context. We need to see what are the needs of our employees. A lack of recognition on the need to promote workers' well-being may give rise to workplace problems such as stress, bullying, conflict, alcohol, drug abuse, or mental health disorders. Potential solutions such as leadership, communication, qualitative leader-member exchanges, and the focus on learning and development are essential for anyone committed to making the workplace a more decent and satisfying place. What do we mean that managers should help them manage with stress? What I did in the General Secretariat Division, which I'm the head General Secretariat Division, is that I told to my teammates to spend half an hour in the morning and half an hour at the end of the day, of the working day, during working hours, never through overtime hours, discuss our everyday issues while in parallel cleaning our office supplies. That twice a day cleaning process, actual cleaning process, our pens, our desks, and to be really anti-stress and relaxing while we felt leaders of the cleaning process, of the things that we touch in our everyday procedures and that might carry the virus. So that was a relaxing procedure that we were involved in. It really felt good, at least in our case, at the Athens Naval Hospital. And resilience, which resilience managers should promote, are supposed to promote resilience, increase resilience, because it is the capacity of a dynamic system to adapt successfully to disturbances that threaten system function, viability, and development. So we need to increase the capacity of the dynamic system to adapt. That is resilience, successfully, adapt successfully to the disturbances that threaten us, threaten our viability, our sustainability, our development. So leaders for organizations to be aware of the issues their team is facing. They should give them skills to work with the problems out for themselves, and not you solve them the problems. You should not solve them the problem. You should give them the skills so that they solve the problems. Deal with organizational challenges such as high workloads, limited resources, and manage staff care after a critical incident. Support links with best practices and examples of organizational protocols. Figure out a witty way to create safe work practices. And of course, displaying empathy. So, think globally and act locally. The world, the hindrances in the workplace. Leaders respond most of the time by order while operating in a bureaucratic system. We should not deny that the crisis is happening and it's there, or think that it's going to settle down, or go away because things are not going to get back to the way they were. Things are changed in a complex way, but we can create paths that will influence the current issue. So most of the healthcare systems and organizations are designed, have a classical bureaucratic system. So they respond by order. And they responded this way when COVID-19 entered our lives, our systems. They are functionally departmentalized and impersonal. And they do not enable fast knowledge sharing and strong relationships within the organization. So the response was that the problem is going to go away, or that the current systems can address the issue, which was, of course, not doable. And what are the steps that we should take during the pandemic? Is go to immediate action and act operationally and not by order. The operational response was aforementioned, and what are the steps of an operational response? Of course, prefix dynamic knowledge sharing, and combine immediate action at the governmental level, allow projects to immediately scale up across the general population. So that is global unity, and the local unity in organizations is that the local, we have seen that the local trends tend to be more appropriate for the situations we are living. We must take the global and implement it into the local and embed it in there. Localities meant that locality is the mentality that people in the organization need to have in order to enhance interoperability, which is the key concept behind the fast knowledge sharing through dynamic relationships in organization. The mindset of think globally, not locally, that that you see here is in the current crisis has been also pointed out by the World Health Organization Director General as an antidote to the virus through the emblematic phrase global solidarity and national unity. So I take it even further and I say from national to local. Okay, global solidarity for national unity, from the global to the local. When we talk about resilience and psychological resilience and the way to support our followers, we must also see paradigms like after the terrorist attack in September 11th in 2001, US college students that had been tested showed that in the wake of attacks, they experienced positive feelings such as gratitude, interest, and love. Feelings that are related to resilience and post-crisis growth in psychological resources. So resilience is a dynamic process in which quiet interpersonal relationships and social support are protective factors. Also, the analysis of Katrina hurricane disaster during the recovery stage revealed that the social capital, with its relational nature and interconnectivity, was the primary recovery element. Following to the aforementioned, the agents that underpin the because my share screen is off somehow. Get you there. That's amazing. So crisis calls for locality. Here's some of the aforementioned based on the global and the local level, in the sense of taking the global and implement it into the local. Knowledge sharing is a critical component of knowledge management. Knowledge management is generally referred to as the way an organization creates, retains, and shares knowledge. Knowledge sharing is the process by which individuals exchange tacit and explicit knowledge in order to create new knowledge. Knowledge sharing is a critical team process that involves members to share ideas, information, and suggestions relevant to the team's task at hand. So at the national level, we have globalization, global awareness, adaptive local response, and in organization, we have enhanced interoperability, strong human relationships, visionary leadership, technology, locality, and shared knowledge. Those agents, if embedded through new process into the system, they will then constitute adaptive channels for both current response and for future readiness. And here is a sum up of the levels of actions, okay, the levels of actions during this pandemic. So in the governmental level, we have designed an adaptive regulatory framework. We need a regulatory framework, build strong partnerships, enhance community participation and community engagement, institutionalize new structures and organization capacities for future crises, and invest on the crisis circle, which the crisis circle is readiness, response, rehabilitation, reconstruction, and prevention. Employee and in the organizational level of actions, we have employee awareness, knowledge, e-documents, work reports, emails, and skills. How to wear the mask, how to clean my desk, how to avoid contamination, reinforcement of fresh ideas in the space of creating adaptive spaces. As we said, it's the entrepreneurial that combined with the operational will create adaptive spaces. Education and training, workforce, for the workforce through formal living programs, for the children through school societies, for elderly with through the primary healthcare. Share culture, attitudes, and beliefs. Okay, share culture is very important. We must. It's like feeling the same way, and sustain trust and cultivate safety climate among individuals by avoiding stigma. So we better say or refer to people with the virus than sick people. Do not stigmatize your people, your classmates, or your co-workers. It's better to say people with the virus. We can't stay in touch, but we stay in touch, like here today. So prevention doesn't have a tangible results because it is constituted by the disasters that will never happen. Prevention doesn't have tangible results because it is constituted by the disasters that will never happen. We don't see those disasters. We just invest on how to prevent from those. So people can see the results of prolepsis only through the lens of health prevention and disaster prevention. Readiness is the other side of prevention, and that is why it is so hard to create and maintain. People in organization societies are in a state of openness to new information. It is about time that leaders around the world invest in developing a culture of prevention and preparedness on bioevents through formal learning programs, through workforce, and through primary healthcare. Keep in mind that stimulation and leverage of novel solutions will occur through an informal and adaptive leadership that brings diverse and independent individuals and collectivities in the local society. So allow rich flow of communication, interconnectivity between healthcare workers and citizens. Share knowledge wisely. And here is the why, how, what process of leadership readiness in a crisis context that me and my colleague Konstantinos Kalens have proposed in our paper in 2020. And the why, how process in this case is the belief that when people have a common vision, the why they do it, they can succeed, that strong relationships can lead to shared knowledge, to cohesion, resilience and adaptation, which in other words, is the how they do it. How do we do it? We do it through strong relationships. We do it through shared knowledge. We do it if we are resilient. And the belief that the common vision, the why, will bring and the fact that this, the how, the way, through strong relationship, will lead us to the what. What do we gain? We gain health preservation for organization, and we gain readiness, leadership readiness for the next time, for future crises. The belief that the common vision, why, will bring success stems also from the military units. Combat performance of military units depends primarily amongst on cohesion, and collective commitment to unit values and goals. And that was supported by studies during and after the World War II, and from others conducted during the Korean or Vietnam wars. And the war, it's a disaster and a crisis, much like a pandemic. So the new normality in praxis. The current need to survive from the pandemic outbreak can be transformed into a shared vision and purpose as to a pragmatic lesson around how an unambiguous purpose becomes the social glue for society. The willing for sustainable work conditions during the crisis can be turned into organizational policies that invest on a groundbreaking leadership processes using existing technology tools and leadership tools. The desire for effectiveness in the meta-crisis environment can be turned into prevention strategies that can be turned into prevention into leadership readiness as work flexibility, support change, openness to change, and new ways of working that support health preservation. Uh, all the aforementioned highlights the importance of why the way society responds to protect health and to stay resilient through the crisis is a process that encloses strong leadership. The COVID-19 pandemic has laid bare the cruelest way the abundant detriments on humankind, but also lightened a new normality ahead of it that must be courageously welcomed with work policies that embed human-centered approaches. What is more, the reverse of the lens through which societies will respond to future adverse conditions is less underpinned by hierarchical structures, of course, and more by the rising global solidarity, society sympathy, local social networking, individual capabilities bonded to national relational structures. Humanity performed a global response which can be metamorphosed into global readiness and global knowledge towards a global future challenge through strong human relationships. The needs and capabilities of organizations vary, so it is not a one-size-fits-for-all data exchange situation. What is needed henceforth is to capitalize all that knowledge, create adaptive processes, and embed them in the local communities and organizations. Complex situation needs complex solutions, and those arrive from deep, meaningful human interconnectivity of sharing knowledge in the local environment, in our organizations, in our universities. The aftermath of do not waste a good crisis, do not waste a good crisis, is that organizations in the specific complex crisis frame are poised to change and adopt leadership protocols in their everyday practices, because events are pushing the systems to change. We are pushed to change. And part of that change is new leadership readiness for the current and for future crises. So that is the end of the presentation, and I wish you have success in your semester's writing examinations and a great summer thereafter. I hope that next year we meet in person and not digital. And again, Professor Helena Martins, thank you so much for the marvelous collaboration. There is some more question and answers after that. Let's see it. Complete the sentence. Which of the following sentences is correct? Leaders around the world should invest in resilience, which is the ability to recover quickly with the help of support, maintain or regain those capacities that are compromised during times of high stress, or plan, organize, and decide what to do next. The correct answer is 2. Maintain or regain those capacities that are compromised during times of high stress. Identify whether the statement below is true or false. Measuring resilience is a simple process. True or false? False. Measuring the way people cope with crises, emergencies, shocks is a complicated, because emergency shock is a complicated process. That is, to measure resilience, one needs to collect data such as income, assets, access to markets, services, safety nets, and adaptive capacity. Question number 3. Answer to the question, which of the following sentence is correct? Why do leaders around the world invest on response and recovery rather than readiness or prevention? Response and recovery actions demand smaller investments. Readiness and prevention doesn't have tangible results. Do not prioritize disaster preparedness activities over other issues that will ensure re-election. Correct answer is 2 and 3. Readiness and prevention doesn't have tangible results. It's the disasters that will never happen. And they do not prioritize disaster preparedness activities over other issues because they want to ensure re-election. And when we invest on something that doesn't have tangible results, may not let people see the results. So we may not be re-elected. Answer the question, what kind of leadership proximity is that? Raising awareness among young people in the 30-39 age group about getting vaccinated with AstraZeneca. Government officials have been vaccinating, setting an example. Is it leading by using role models? Is it leading by sharing knowledge? Or is it leading by example? The correct answer is 3. What leading by example should mean is that our behaviors and actions influence others to behave and respond in ways that we view as viable and appropriate for our organizational outcomes. These are the recommended papers and websites for you. Maybe there are some more questions and answers by Professor Helena Martins. And goodbye from me. Goodbye from Greece. I hope to see you in person soon. Goodbye, University of Lusofona. Thank you very much.